Bornholm disease. It is named after a Danish island called Bornholm in the Baltic Sea in Northern Europe. Now, and it's also called the devil's grip. And now it has the symptoms of sudden pain in the upper abdomen and in the chest, also profuse sweating and increased temperature. And the pain is stronger on deep breathing, on cawing, sneezing, yawning. And there's no vomiting. There can be cawing, but no vomiting. Now, if someone has this type of pain in the upper abdominal or chest, they should consult immediately a doctor. And the doctor looks on what it is, if it maybe is appendicitis or something else, or pneumonia. If it is Bornholm disease, then rest is prescribed and painkillers. And now it can come to complications. It can infect the pleura, that is, if a delicate membrane separating the lungs from the inner side of the chest. It can affect the lungs themselves. It can affect the heart, the brain, and liver. The incubation time is 3 to 5 days, so in that time that the person can have got the infection, but it doesn't break out. And it comes through in epidemic form, so it comes from other people through coughing or sneezing, so through contact with other people. That is the only form to avoid it, having no contact with other people. And it should last for around 3 to 7 days, and then it should go away. It can be that it is apparently healed, but then it can come to relapses. But after around a week, it should be gone. That is according to Keith Hodgkin's Family Medical Advisor book, written in the 1970s, on the page 94, but this is no medical advice. If you click this video away, then please tell me what the reason for it was, so that I can improve. Otherwise, hi, welcome. I'm trying to learn medicine. Today, Bornholm disease, and after we've done that, we're gonna do extensor carpal strength training with us here. And if you participate in the extensor carpal strength training, then it's at your own risk. And we're talking about a disease and internal anatomy. And this is no medical advice. I'm just reading the text and trying to understand it. Bornholm disease. A painful virus infection that may occur in epidemic form and which mainly affects children and young adults. It gets its name from Bornholm, a Danish island in the Baltic Sea, where it was first identified. It is also known as devil's grip, epidemic myalgia, and pleurodynia. Okay, what did we have here? It's named after Bornholm, an island in the Baltic Sea, a Danish island in the Bornholm Sea. It's also called the devil's grip, maybe you want to say it. Devil's grip, epidemic myalgia, or pleurodynia, devil's grip. And it can be epidemic, so it can be spread. Sudden attacks of severe pain in the upper abdomen or chest. Sudden attacks of pain, upper abdomen, chest. Rapid, shallow breathing with increased pain on deep breathing, laughing or yawning. So a rapid, shallow breathing and a stronger pain if people breathe deep in, laugh or yawn. High temperature, profuse sweating. Does it mean a lot? I don't know what the word profuse means. Profuse sweating. There may be a slight caw, but there will be no vomiting. Okay. A slight caw, but no vomiting. Sudden attacks of pain in the upper abdomen or chest. And rapid breathing, and the pain gets stronger when the person breathes deeper in, laughs or yawns. The other thing was breathing, laughing and yawning. Or deep breathing, laughing and yawning. And what about cawing? High temperature and profuse sweating. Okay. Incubation period, 3 to 5 days. Okay, for the first 3 to 5 days, no symptoms are visible. Duration, 3 to 7 days. And then 3 to 7 days, 3 to 5, 3 to 7. Causes, a virus spread by direct contact, especially cawing and sneezing. A virus caught through cawing and sneezing. Complications. As with many virus diseases, infections of the pleura. I don't know where the pleura is. Let's take one look if you find the pleura. Pleuresis. The lungs are separated from the inside of the chest wall by pleura. So the lungs are separated from the inside of the chest by pleura. A delicate membrane which is lubricated by a thin film of fluid. This allows the lungs to expand and contract smoothly when breathing. Pleurisy can take one of two forms: dry, in which the membrane becomes inflamed, or wet, in which excess fluid is produced, separating the lungs from the chest wall. Both types have similar symptoms and usually occur as a complication of other diseases. Sharp and stabbing pain. Causes: infections due to viruses and bacteria, pneumonia, cancer. Injury to the chest wall. Outlook: depends on the underlying disease. Okay, pleurisy. The pleura is a delicate membrane separating the lungs from the inside of the chest. Between the lungs and the chest, or the inside of the chest. The pleura. Okay. We have complications. Infection of the pleura. Lungs, heart, brain, or liver occasionally occur. Pleura, lungs, heart, brain, liver. Pleura, lungs itself, liver, heart, brain. Liver, heart, brain, liver, heart, brain. Pleura, lungs. Okay, they can be infected. Rest: take pain-killing tablets in doses recommended on the container. It's no medical advice. Hold a hot water bottle wrapped so as to prevent burning the skin against the most painful area to ease the pain. Again, no medical advice. And the book's from the 70s, maybe most not. What the doctor might do. So when you come, immediately consult the doctor. If there is severe chest pain or abdominal pain, what the doctor might do. Examine the patient to make sure he or she is not suffering from another illness with similar symptoms, such as pneumonia or appendicitis. Prescribe stronger painkillers once the diagnosis is certain. Prevention: avoid contact with affected individuals. Outlook: recovery is complete within a few days. Relapses may occur soon after apparent recovery. Relapses may occur soon after apparent recovery. Relapses, I don't know the word, but it means it comes back. And it can come back soon after a recovery, an apparent recovery had been made. Okay, we have all the information. Bornholm disease, the island, devil's grip, or the other thing with myalgia, epidemic myalgia, sudden attack upper abdominal and chest, profuse sweating, increased temperature, no vomiting, but maybe cooling, increased pain on everything first here. Now you have increased pain on breathing in, on deep breathing, laughing, and yawning. And 3 to 5 days incubation, 3 to 7 days a week duration, but there can be apparent healing of it, and it comes in back. The only thing is avoid to have contact with people. It can be spread through coughing and sneezing, but probably breathing also, coughing and sneezing. And the treatment is first to consult immediately a doctor who then clears that it's something else, and then painkillers. Recovery should be within a week. Want to start again? That was it. Pleura, lungs, heart, brain, liver. Bornholm disease. It is named after a Danish island called Bornholm in the Baltic Sea in Northern Europe. Now, and it's also called the devil's grip. And now it has the symptoms of sudden pain in the upper abdomen and in the chest, also profuse sweating and increased temperature. And the pain is stronger on deep breathing, on coughing, sneezing, yawning. And there's no vomiting. There can be coughing, but no vomiting. Now, if someone has this type of pain in the upper abdominal or chest, they should consult immediately a doctor. And the doctor looks on what it is. If it maybe is appendicitis or something else, or pneumonia. If it is Bornholm disease, then rest is prescribed and painkillers. And now it can come to complications. it can infect the pleura, which is a delicate membrane separating the lungs from the inner side of the chest. It can affect the lungs themselves. It can affect the heart, the brain, and liver. The incubation time is 3 to 5 days, so in that time that the person can have got the infection, but it doesn't break out. And it comes through in epidemic form, so it comes from other people through coughing or sneezing, so through contact with other people. That is the only form to avoid it, having no contact with other people. And it should last for around 3 to 7 days, and then it should go away. It can be that it is apparently healed, but then it can come to relapses. But after around a week, it should be gone. That is according to Keith Watkins' Family Medical Advisor book, written in the 1970s, on the page 94, but this is no medical advice. I'm going to stop the camera. That was a medical part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the extended couple and strength training, that's the risk. We're having a good and stable stand, always, and the legs, the hands, next to the body, and bring them the fists down, hold it, and up. The flat cat exercise. Take it down. We're having 3 rules. The first rule is that we are stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort. Next exercise, we quantify money check, fists, and down. And the third rule is that we're not overdoing it. We just want to strengthen, not to exhaust. And again. And now to the next exercise. You can use a sock or t-shirt or towel or something else. Have it in the hand and press with good, moderate force onto it. And then bring the hand down. And again. Press evenly with all 5 fingers. Also with the 4th and 5th, so that you train the extensor couple nerves. And then your head. Press with good, moderate force. And again up. And again up. And up. And on the other side. Now take it again and turn to the outside. Again, all painless, only as far as it goes to the inside again. And outside. Again. Other hand. And now just press one more from the top and again. Alright. Now just breathe. And that was the extensor couple nerve strengthening. Thank you very much.